I was born with a developmental disorder, and honestly, that piece of my life I kind of hid away from the world. When I was younger, I was ashamed of it. So that's actually one of the main reasons why I was interested in it, because that's kind of what happened with my story. And even my own father at the time, he just thought, like, the terrible R word that people like to throw around. So since I didn't get it, I actually had time to myself where I had to sit down and think, okay, what do I want with my life? And luckily, if I got the Rhodes Scholarship, I wouldn't have done senior house officer year. I would have gone off to England, but I had to do senior house officer year. And the first day is when I did ENT. I didn't think it was possible. They didn't think it was possible. And I think that's kind of why, I'm here today. And I kind of want to show people that it's possible with the right resources.
Hello. You're listening to the IMG Residency Match podcast, where ambitious international medical graduates like yourself get the insider strategies and inspiration you need to match into residency. I'm your host, Shauna K. Lester, the founder of Memorable Essay and the creator of the IMG Residency Match Application Accelerator, a program that helps you create a memorable residency application to match. So if you're looking for proven strategies to match and the inspiration to create a medical career you absolutely love, you're in the right place. Let's get into it. You're going to love today's episode because it is full of surprises. We are joined by Dr. Joshua Wright, an Otolaryngology head and neck surgery resident at Duke University. Valedictorian of his graduating class at the University of the West Indies, Dr. Wright went on to be a Rhodes Scholar finalist. Today you're going to learn about how his medical career is driven by his advocacy for children and what you need to do differently when you want to match into an ultra-competitive specialty. Welcome and thank you for joining us. So today I am so excited to be talking with Dr. Joshua Wright. I've heard so much about Joshua from other people in the IMG community, as well as former clients, and just heard that he's doing such great and wonderful things in head and neck surgery. And so I'm looking forward to hearing his story today. And I'm really looking forward to what he shares about his path, being inspirational to you or being a guide to you if you want to do hard things just like he's doing. So welcome, Joshua. Thank you for being with us here today on the podcast.
Thank you for having me. I'm happy to be here.
Absolutely. And so it's always good to start at the beginning. Who is Joshua Wright?
I'm an international medical graduate, as you mentioned. I went to University of the West Indies. I graduated in 2018. I worked in Jamaica, did internship SHO. And then in the past few years, I worked in the process of applying for ENT residency in the States. And now last year in the 2024 I matched into ENT, currently at Duke University. Yeah, that's about it, like a quick summary. Other than that, I'm Jamaican, as we mentioned already. Hope to one day come back to Jamaica. I'm still a Jamaican at heart. That's where my heart lies.
And maybe we can dial back to the childhood, because I always love to hear about how people grew up. What parish did you grow up in, and what are your fondest memories of your childhood?
So I grew up like most others in Kingston, in Jamaica. Fondest memories. So growing up, actually, we were very involved. Me and my brothers were very involved in motorsports. So actually, for most of my childhood, that's what I remembered. I wanted to be a professional race car driver. I went in motocross as well. And then actually, that's how I eventually found medicine. Actually, I found medicine through the sports aspect of it. Actually met with orthopedic surgeons who I actually raced with. And that's actually when I first thought about doing medicine. So I kind of late into high school is when I finally made the decision into medicine. Before that, I was interested in law. At one point, I'm still very interested in culinary arts, hoping to one day actually transition into culinary arts in the future. Hopefully one day that opportunity will present itself. I actually was promised throughout med school that if I graduate med school, my mom will let me go to culinary school for a bit. Still waiting on that.
All right. Do you have a favorite kind of cuisine? Is it that you would want to be a restaurateur? How would you want to be involved in food?
Actually, like you mentioned, I want to be a restaurateur. I like the whole idea of creating a theme, providing a service. I like the whole restaurant industry. A few of my friends in high school actually went to culinary school, and I'm still jealous of them. And also, just the art/artistic side is kind of a blend of art and science, which is in my mind, kind of like medicine, how it is. So a lot of the skills, a lot of the mentality, even the career paths are kind of similar as well. Yeah, it's just kind of providing a service for people. And in general, I knew that I wanted to do any form of career path that I could actually be providing a direct service for people.
So, as you're going through medical school, was there ever a time when another specialty caught your eye, or from beginning to end, you kind of knew it was ENT?
No, so throughout, even before medical school, I thought I was going to do orthopedic surgery. That's how I fell into medicine first. Like I mentioned, just through motorsports, I thought, orthopedic sports medicine, that's what I was interested in. So throughout med school, I was always orthopedics. Even after med school, I did internship. I did senior house officer, which is in a year of work in Jamaica. And I kept on doing orthopedics over and over. And it's really late in my second year of senior house officer after med school is when I actually finally decided to do ear, nose, and throat. So it was a really late decision. But when I actually had some time to really sit down and think about it, I realized that it was really a decision that was building upon itself throughout my life. I just think, in Jamaica, sometimes what happens, we get, exposed to certain specialties more than others, or certain specialties get more attention. So, orthopedics is a big common specialty that a lot of people are very interested in, especially in Jamaica. And like, neurosurgery, general surgery, and these other specialties that are a bit more common. And ENT wasn't that very, not much people were really interested in it. It's only until I got exposure to it that I realized, really learned more about it, is when I realized that it was for me.
What were some of the transformations that you saw happening for patients in ENT that brought you to it? That direct service aspect that you mentioned earlier, was it that you were able to serve patients in a kind of niche way that you hadn't found in orthopedics or any other specialty?
Yeah, so that's really the real reason why I went into it. A little bit of background on myself, I should have mentioned. So I was born with a developmental disorder. It's called developmental speech apraxia. So I actually went to 10 years of speech therapy when I was younger. And
Oh,
actually, when I was 3, it took many years to be diagnosed. And it's actually an ENT surgeon that I was taken to an ENT surgeon when I was younger because I wasn't speaking. And they're concerned that I had hearing loss as well. And they recommended me to go see a speech therapist. And it's only then when I got diagnosed with my speech disorder. And honestly, that piece of my life, I kind of hid away from the world for most of my life. Is when I was younger, I was ashamed of it and I, was very embarrassed by it in a way. I never really embraced that side of my like lived experience until later on. And then when I started seeing ENT and I started working with patients with communication disorders and actually started doing a deep dive into my own past, and then I really could relate to the patient population in general, just in conditions that are very abstract that people can't really express or people can't really it's hard for them to express to other people or it's hard for other people to empathize with. I realized I wanted to treat patients like that. Sometimes when you see things like orthopedics, it's right in front of your face or other conditions, it's very easy, very tangible. People can relate to it. But in ENT, I realized I treated conditions that are very hard for people to understand. For like little things like hearing loss, nasal obstruction, communicating, things that are really like detrimental to people's livelihood, quality of life, but people kind of overlook it. And it's those conditions that people sometimes overlook that, a condition like myself as well, that honestly is sometimes overlooked, that I really wanted to work with those patients in these conditions that are often overlooked, but still affect their quality of life so much.
what is the clinical experience like looking back, your ENT experience, but in Jamaica? And where in the trajectory of that experience do you decide that this is what you're going to go after in the match?
So in Jamaica, I admit that one of the benefits of our program that we get a wide exposure to multiple specialties. So in America, for example, most med students, unless they're interested in ENT, won't get that exposure. So actually, in Jamaica, every student got exposure to ENT, and I think that exposure is actually very good. If I didn't get that exposure, I wouldn't have probably been interested in ENT. But then after I got the exposure in Jamaica, then I realized started seeing the deficits. I started doing a lot of advocacy work in the area, especially with communication disorders. And I just saw the lack of resources in Jamaica and the lack of availability that we had, not only with ENT, but other peripheral medical providers that we had as well. And then I saw that for me to really provide the care that I wanted for those patients, I needed to go away. I needed to go and get exposure to that. For example, for me with my own disorder, when I was first diagnosed, I think there was maybe 2 or 3 speech therapists in the whole island. Currently, there's probably like 7 to 8 right now. And comparatively, in the States, where each hospital, like our current health system has nearly 100 speech therapists just in our hospital network. And that is, we don't have enough compared to our own island where we don't have enough. So it's like, I saw that for me to actually provide that care and actually find those patients that need the care, I needed to actually be exposed to how this care is being given and actually see in a way how I can bring this back to Jamaica in the future or how I can help change it in Jamaica. So it's really just doing a deep dive into the career path. I realized, okay, there needs to be more that needs to be developed. And also I wanted to learn more. I wanted also being able to get into the niche, those diseases or those conditions that aren't really well understood. And I really needed that exposure elsewhere to be able to really get that what I wanted.
I've been seeing floating around on the internet, and you can tell me if you see this a lot in your clinical practice. I have young children, and so I have friends with young children. And there's lots of conversation going on about children being misdiagnosed as being on the autism spectrum when they simply have a speech delay or they have some other medical issue. Do you see that a lot? Do you find that people don't understand the communication aspects of what you do and that children and other people are misdiagnosed with other things?
Yeah, so that's actually one of the main reasons why I was interested in it, because that's kind of what happened with my story. Just be quite frank, like I said my first words when I was 3, which is very late for most children. They say their first words when they're 1. And even my own father at the time, he just thought like, the terrible R word that people like to throw on the retarded word. That's what he thought I was. And he still loved me, just accepted it as it was. And it was because my mom who really pressured and pushed and pushed. We went to the States, we went to England trying to find a diagnosis. And yes, I was tested for autism as well because that was a main differential or other conditions on the spectrum, because a lot of communication disorders, they're so interrelated with developmental disorders or anything on the spectrum as well. So they're so related, and especially I found that especially in environments where they don't have a much awareness of these conditions, they're often misdiagnosed and pushed aside. And if they're not treated early enough, then they'll progress and get worse and get worse, and children won't be able to find their full potential. And I realized even with my own story, if didn't find that care from early on, I wouldn't have gone to a regular school, I wouldn't have excelled, I wouldn't have gone my therapy, I wouldn't have been able to do all that I'm doing now. So that was actually one of the driving forces why I wanted to push and excel and do a competitive specialty, go to the States, because I kind of wanted to push that narrative of what can happen if people get the right care at the right time. And that's kind of been one of the driving forces and one of the reasons why I want to keep on pushing, because I'd want to make sure that just like myself, who luckily I was fortunate to have my family had enough resources to get me the right care. But so many people are not getting the right care. If I didn't get the right care, I wouldn't have probably gone to a regular school. I wouldn't have gone to high school. Definitely wouldn't have gone to medical school. And so I'm hoping that one day I can pay that forward and give the right care that people needed.
Wonderful. And that is a very powerful testimony. And speaking of doing hard things and excellence, we have a Rhodes Scholarship nomination shortlisting. How did we not end up in England? How did you end up in the United States?
Yeah, so on it, and this is like something I tell a lot of people. At that point when I was applying, I don't think I fully understood myself well. At that point, I didn't even know about that I wanted to do ENT. I still wanted to do orthopedics at that time. And I think what happened with me, which happens to a lot of people, they get pushed into a high achieving narrative of just keep on getting good grades, go to medical school, and they don't really have much time to really think, okay, who are they? What do they want out of life? What's their direction? And I think that was one of the things that affected me, that I didn't know what I wanted to go off to England to do. I just knew, okay, I wanted the Rhodes Scholarship. But if you ask me why, I couldn't answer why. I didn't know what I wanted to do with it. I didn't know what the next step was. I just said, okay, if I get the Rhodes Scholarship, then the next step will present itself. So it was actually one of those blessings in disguise. I didn't get it. So because I didn't get it, my plan was throughout med school, my plan was to get the Rhodes Scholarship. Previous Jamaicans who got the Rhodes Scholarship, they all ended up matched. A lot of them matched in the States, doing excellent specialties at Harvard and elsewhere. And I said, okay, that'll be my story. I'll get the Rhodes Scholarship. I'll match in whatever I want to, and then I'll figure it out then. So since I didn't get it, I actually had time to myself where I had to sit down and think, okay, what do I want with my life? And luckily, if I got the Rhodes Scholarship, I wouldn't have done senior house officer year. I would have gone off to England, but I had to do senior house officer year. And the first day is when I did ENT. And it actually gave me some time to think, okay, who am I? Who is Joshua? What do I want to do with my life? So it was a blessing that I actually had that time to think it through. And then at that point, I said, okay, well, now I know what I want to do. I want to do ear, nose, and throat. Now I need to kind of think of a pathway through it. I had to start working hard, open my books again, start the whole journey. I admittedly started the whole journey late because throughout med school, I was really focused on just getting good grades, being at the top of the class, getting that GPA because I was aiming for the Rhodes Scholarship and it needs like a 3.7 GPA. So that's what I was focused on. I never had time to think, okay, what do I want to do with my life? So I never started studying for the steps, never really knew much about the steps. I had friends who were kind of doing it, but I didn't really think about it, didn't really know what it was. So it's only until after I finish SHO is when I started doing it. So I started the whole process late. So that was around 2020 is when I started, doing step one and all that. So it's kind of late in the game, and I don't recommend other people do that. And I just do recommend that people from early don't even think more so go to the States or England or wherever, but more think, okay, what do you want to do with your life? I think that's a more important question, and find where you're going to find enjoyment. And I think once you have that decision, then start thinking, okay, how are you going to get to that point?
Yes, there's a lot that could be said. There's a lot that I could say to that, but I will just continue getting more out of your story. But I 100% agree and co-sign. It's actually a really common thing with high achievers, and I think that almost happened to me as a person as well, because you just know what the boxes are to tick to just keep excelling, just come first, do this, take the next step. But to really search, do I want to actually be making food? Do I want to build a company? That can take a bit more time. So in all of this now, I'm going to get to your own match journey, but I want to hear a little bit about how your family is, how they're adjusting to the new Joshua that's emerging. I have this new love, this new specialty that I want to go into. I'm finding this new purpose because I'm hearing about advocacy work and I know where I'm going. Like, how is your mom as the person who took you, or she's spearheading charge to get you the therapy that you needed? How is your dad who loved you no matter what? How are they responding to this? What is the response like in your social support network?
It's been a pleasant surprise for them. Like I mentioned growing up, and I should have mentioned this in my background, but just to be transparent. So like, the Jamaican system that, from GSAT, well, it's called, I think, Common Entrance or whatever it's called now, PEP, sorry, that they call it now. From that early age, people are so focused on being a high achiever, going to the right school. Because of my communication disorder, I wasn't that student. So I couldn't, everyone wants to go to Campion to get into med school. I couldn't get into Campion. Both of my brothers actually were top students. Both of them got government scholarships, went to Campion, and they were the ones who were supposed to be doctors. I was never that person. And it wasn't because at that point, although I had my diagnosis and I was getting speech therapy, it still wasn't, no one in my family really believed that that was going to be me. So really, there was no pressure per se on me. So like my other brothers, they had to get the good grades. For me, it was, you're just doing good, Joshua, just keep at it. There wasn't no external pressure. Oh, you have to, because I think it took them a while to realize that I could actually achieve what others could do, because it's so much harder for me to do that in like a regular school system. So it's only until like late in high school, literally the last 2 years in sixth form is when I started excelling in school. And it's because a lot of personal things that happen in life, and I just really got the jump start. So it was really a shocker for like everyone around me, like, okay, wow, all this stuff are happening. Both of my brothers went to school in America. I just didn't think it was really necessarily an option for me. I wasn't really focused on it because I wasn't supposed to be that, top student. So when all
And
this,
by school, do you mean high school, college? When you say
oh, so they
school?
both went to college in America.
Okay.
And that was the plan. Both my parents always wanted all three of us to do high school in Jamaica and then go to college in America. But because, and also because med school is supposed to be better in Jamaica and it's cheaper and everything, that's why I decided to stay here. And at that point, I wasn't the student that you would think of, okay, we should invest and make sure you get those opportunities. So it's only after that when things started presenting itself, when it's okay, well, what do we do? What do we do with it now? So there, yeah, it's been a great surprise for everyone. Yeah, my mom, she's been the super most amazing support network. She's the one who really pushed for me to get all the support I needed when I was younger. She personally took me to speech therapy 3 times a week for 10 years.
Oh my
But yeah,
God.
she said,
Oh my God.
yeah.
Wow.
But she still says that she still is shocked to see all that has come from this. And obviously it's worthwhile the amount of investment that she did. But yeah, I didn't think it was possible. They didn't think it was possible. And I think that's kind of why, I'm here today, and I kind of want to show people that it's possible with the right resources. And that's why I'm trying to get the right resources.
So time for the match. Tell us. So we have valedictorian, in his UE Mona class. I didn't clarify earlier, but for people who are not from the Caribbean, when he says SHO, it's the house officer year that's senior to his intern year. So Josh was valedictorian. He's a Rhodes Scholar finalist, and now he decides he's going into the match with what he wants to do. For those who don't know, what are the odds of an IMG being successful in the match process for ENT?
So unfortunately, so before when I was interested in orthopedics, those odds are terrible as well. And then I said, okay, let's go into ENT, and I realized, wow, those odds are equally as terrible as well. Unfortunately, I kept on choosing things that were hard. But when I first started looking at the process, I looked at the chances of an IMG matching, and there were 0%, 0 to 1%. Each year they may accept 1 or 2 IMGs. This year they accepted 7. My year they accepted 8, which is like high. Some years they may not accept any IMGs. There's only 350 spots. IMG is one of the more least IMG friendly options you can do. It was pretty much near impossible when I first looked into the process, and I still said, let's go into it. I'm not sure as yet, but I think I may have been the only person from Jamaica who's gotten the ENT. So there wasn't really someone else to talk to about this process. There wasn't even other IMGs. There's very few IMGs in, the world in ENT right now. So yeah, it's very, very low odds, but it's possible.
A quick pause to thank our sponsor, the IMG Residency Match Application Accelerator. The IMG Residency Match Application Accelerator helps international medical graduates like you create a memorable application to match. Learn more at bit.ly/IMG match. Now back to the conversation. And if you were to talk with someone who's looking on, thinking, okay, I want this for myself, as an international medical graduate from the Caribbean, from Africa, from Southeast Asia, from China, from anywhere, what are some of your best tips? What should they be doing as they're going through medical school? I should probably break it down in 2 parts. And then once they actually come into the period where it's time to get into high gear, what should they be doing?
So I think, especially if you want to do something competitive, one of the things I tell people that when I first started looking at the process, everyone can give you advice about matching, but when you want to match into something very competitive, the advice is a bit different. So the things that other people focus on, yes, you should focus on, but it's a little bit different for competitive specialties. You have to focus on other things. And like other things that people say are, optional for the competitive, it's on mandatory, there's not even an option for you to not have it. So I tell people, even for me, like when I finished senior house officer year, I didn't have any of my exams. I didn't have any of that. And I had to really start from scratch with the process. And I said, okay, what do I have to my, quote unquote resume? And I had, a few years of doing great in school and getting all these stuff. And I tell people that at any point of your journey, just make sure you're excelling at that journey, because people would see hard work and growth at wherever you're from. So many times where I got interviews or I spoke to people, I did 2 years of research. And although I didn't have, all the things compared to American students, they could see that I was a hard worker. They could see that I excelled. They could see that I set goals for myself and I accomplished them. So I know some people are especially in medical school, and I kind of warn people not to do it. They're very tactical and strategic. Okay, I'm not going to worry about grades. I'm going to worry about networking. I'm going to worry about meeting the right people or doing these little things. And yes, they're very necessary, but also at the same day, you need to be a hard worker. You need to show that you can get the job done. So wherever you're at, even if it's in medical school in Jamaica, those grades, honestly, at the end of the day, me being valedictorian didn't really matter too much. Most of the other IMGs are all valedictorians as well. Most people are top of their schools. So that doesn't really differentiate you, but you kind of need to show that you're a hard worker. So make sure you excel at everything you do. Other things I tell people as well is just to have a really good understanding, which I mentioned before, good understanding of who you are, what do you want in the future. My personal story as well. I know that for me in my interviews, it was very easy to talk about it. A lot of the jobs and positions in research I've gotten was because of my story. For example, I did a 1.5 years of research in cleft palate. And when I was interviewing for that position, they were saying, you're one of the few people who actually understand what it's like for a child who cannot speak or cannot communicate, and who actually is very interested in this realm. Like no other person is so interested in this, right? So that's why they gave me the job as well. It wasn't because I had excellent scores or anything like that. It's just because I knew what I wanted out of life. I knew what I wanted. I knew what what my interests were. So spending some time to really know what your interests are, knowing what you want, people will relate to that and gravitate towards that. Other things as well, I tell people also make sure you understand the process before you start using money. This is a very expensive, painful process. I took at least 3 months just understanding what do I need to do for this process. I didn't start studying yet. I didn't start paying money. I just said, okay, let me just start understanding what this process is. I spoke to a lot of people about it, trusted people about it. I had a cousin who matched as well. I had a lot of my friends who matched as well. I got a lot of different advice from multiple directions as well. Kind of learn about the process before you start into it. A lot of people start the process before they fully understand what it's going to take. That it's going to take years. I tell people from the day that you make the decision to match, it's going to take you minimum 2 years to match. And then also the finances, you have to look into that as well. There was, after senior house officer year, I didn't work for at least 13 months. Luckily, I had some savings. Luckily, I had a very supportive family. Even after that, when I started doing work in the States, I worked for a year and a half, well, 2.5 years in research in the States. It was very low pay. I tell people it was much lower than any pay I would have gone working in Jamaica. So it is a sacrifice. It's a long-term commitment. So you have to be prepared. Okay, am I willing to make that long-term commitment? Putting life on a hold, getting married, kids, all those other things. You kind of have to think that through as well. And then once you start thinking all that, think, okay, is this worth it? Do I really want to do this? And then you go ahead and get it done. But you really need to think about all those stuff. Other things as well is just to look at your own resources that you have, reach out to people in your local environments. I reached out to all the ENTs in Jamaica and I spoke to them about this process. I, try to network, find who I can speak to in the States. I found some Jamaicans in the States who are in ENT and, I started building on there and other things as well, especially if it's something very competitive. In general, you need to start thinking, okay, unfortunately, the rough, when it's very competitive, I tell people, unfortunately, they're looking for a reason to say no to you. So you just can't give them a reason to say no. So like having failures in your exams, or like, for example, not having research, which is not as mandatory for other specialties, but for something like ENT or competitive specialties, everyone has research. So you need to kind of have that as well, or like US clinical experience or like US letters of recommendation, things like that. Like in the very competitive specialties, it's nearly to the point that you need to have these things. It's not absolute, but it's just much easier to have those things. So you need to start navigating how am I going to get these things as well.
I want to spend a little time on the research because I do want for people to be able to listen to this and have somewhat of a blueprint. You identified that the research would have been pivotal, not optional. How did you go about finding a research opportunity and how heavily do you think that weighed into your selection process in the end?
So unfortunately, I started my whole process in 2020 when Corona hit, and that was the worst possible time to do anything in this process. The few research positions that are out there, they just got minimized more because of Corona. But I kind of did, honestly, I went on every hospital's website looking for research positions, specifically in ENT. At first, I couldn't find any, and a lot of positions just had to cut their funding because of the whole Corona situation. But I just emailed people. So all those 13 months where I was like studying, doing steps and everything, I was actively looking for positions, research positions, observerships, anything. And then I just applied, sent out many, many emails and just waited until something bit. Originally, I wanted to do ENT research. There was just no opportunities at that point. So that's why I mentioned I did research in cleft palate, which was actually in plastic surgery, but it was the closest thing I could find to ENT. And I did that for a year and a half. And then actually, when I was doing that research for a year and a half, it was great. I was publishing a lot. But then I actually spoke to a few mentors and a few people in the realm, and they kind of told me that for something competitive like ENT, I need to do research in ENT in a department that actually has an ENT program, because other than the research itself and the publications, the main reason that you're actually doing research, unfortunately, is to actually build these connections, build a relationship, and like get your face out there, get known, go to conferences, let people see you, know who you are. So that was the main purpose of the research. And yes, to show that you're productive and can get publications done as well. In general, especially for like ENT, I realized I'm speaking to a lot of people weren't going to match you unless, or even give you an interview unless they knew you from beforehand. You need to make sure they knew you. And that was one of the ways that they knew about you, that you're doing research, you're publishing, you're presenting. So that's one of the ways you can get known. Other ways you can do like prelim years or things like that, but you just need to make sure that you're known in the US system. Yeah, so that's just a common pathway. And honestly, like I said, I sent out a lot of letters, applied for many positions. Most of them didn't bite. Just to be totally transparent as well, one of the limiting factors is citizenship status and visa status. Just to be fully transparent, and I believe one of the things in this process, you need to talk to people who are very transparent to tell you the ins and outs. I'm a US citizen, so it made it much easier to get US research positions. Many research positions
Yes.
are just not gonna, they're not gonna apply, hire someone who's not a US citizen because of funding reasons. So that's a big limiting factor. There are research positions out there that do sponsor visas. I have a few friends, IMGs in ENT, who found positions like that, but they're very hard. One of the things I recommend to people is to like look at other IMGs in the field, look at their pathway. In my year, the 8 IMGs who matched, we all know each other because we were all in the same, we all did the same thing. All of us were quote unquote valedictorians. All of us did 2 years of research. All of us did observerships. All of us were in the process for years. And a lot of them actually applied for years before that and weren't matching. And I actually reached out to them and they gave me advice. So it's literally that's a trend. And then look at their places, look where they did research, apply to research places that they already did research. And I did that as well. And kind of follow the path that other people did because there's a reason they took that path. So reach out to them, find out their path, apply to the places that they already worked at because that then you at least know that that's a place that is willing to take IMGs, willing to sponsor IMGs, and that's how a lot of ways that I got a lot of positions that I did.
And in the 8 of you who were selected in your year, among that group of IMGs, were there visa requiring IMGs in that batch as well who had found research opportunities?
Yeah, I think out of the 8 of us, I think 3 or 4 of us were US IMGs and others were visa requiring IMGs. And one of my closest friends, she's from Colombia and she actually applied 2 years. The first year, I think she got 3 interviews when she did not have, she was visa requiring. And the next year, she actually had a green card and she did a lot of other things and she went up to like 15 interviews. And she did say that, that does make a difference. And that's another thing to look at as well. It's not like internal medicine or other specialties where they're used to IMGs in very competitive or very small specialties. They're not used to IMGs. Many programs have never ever matched an IMG. They honestly, quite frankly, may not even know how to match an IMG. They may not know how to apply for the visa process. So you have to look at those stuff as well, if the program even has capabilities to do that as well. So yeah, those are the things you kind of need to look in it. But visa requiring IMGs do match in the ENT. It's not an absolute. You just kind of have to look at which program is available and are willing to do it. And in general, most of the top programs are capable, are willing to do it. But it does, especially when you're doing research, observerships, those little stuff trying to be in the system. Most of us, I think all out of the 8 of us, I think all of us were in the system already for at least a few years in the States. So all of us were up here and, so to be in the system for a while, it helps if you have citizenship or, have a position that can sponsor a visa.
Yes, and I think that's very important for the individuals in the support system to know as well that it is not optional, as you're saying. So if your wife, husband, cousin, sister, friend does need to take 2 or 3 years to do this free work in the United States, you're hearing why it is absolutely important and why your support is priceless. So speaking of top programs, Joshua, please tell us where you ended up for your residency and how has the experience been so far?
So I ended up at Duke University, which actually is on one of the programs in ENT that has a history of matching IMGs. There's currently an IMG in our program now, and it's been great. I think one of the things that's been great for me is one, their program that is used to IMGs is very diverse. So I feel very welcome there. It's a lot of exposure to like everything that I would ever want in ENT. There's no like lack of resources exposure there. Also, just for me personally, being Caribbean person, it's not too far north for me. So that's been amazing.
Yes.
It's still a bit cold for me, but still not too bad. But it's been a great time here. I actually did a year of research at Duke before I matched there. So at least I got to know people and kind of know what the environment was. So I knew that it was environment I was comfortable. Then I kind of knew great people in the program for me as well. So it was overall happy with it.
How did you keep yourself motivated in that time when you were in the waiting room? So you're doing the research, but you know that that's a part of your greater ambition or your greater plan. Did you feel impatient at any point? Did you feel anxious at any point? Like, what if I'm giving away all of this time and it doesn't work out the way I want it to in the end?
Definitely, I felt that, especially when you're seeing like friends who are matching to other specialties and you're seeing people moving on. And like it's kind of hard, especially for me. I was only person I know who matched from Jamaican the ENT. So there was no one to kind of relate to in this path. Or like only person really applying for such a like really competitive thing, so they understand the situation. And one of the things that really helped is to kind of build a network. Like I mentioned, I reached out most of the IMGs, we know each other. We met
Yes.
each other at conferences, every big conference and everything. So I reached out a lot. I made a network with people. I built a kind of community. So like I mentioned one of my friends who's from Colombia. I think of her as like my IMG best friend in the process because we went through the whole process together. Literally, I realized, okay, I thought I was, I thought my resume was pretty good, but then I realized all of us, we have the same exact resume. We all went through the same exact thing, all the way from family, all stuck doing research for a few years. So it was good to have that community in a way to kind of help motivate you. And I think because no one else fully understands it, I think that's one of the issues that people don't realize that, people say, oh, well, I know someone who, matched with that, or I know someone who did that. But then it's like, it's kind of hard for people to explain why you're doing this. People would say stuff, oh, why you don't need research to match. And like, yes, that is true. You don't need it, but also it just helps so much more. And then even, for example, in the years that I could have applied, I actually wanted to apply for many years, like 2 or 3 years before that. And luckily I had good people in my corner who were advised me not to apply in those years because they realized that it wasn't going to be beneficial. Like my application wasn't ready yet to apply. Or like even my scores as well, just quite frankly, like it was just not an option to get a low score. I had to make sure that I waited, do my exam until, I say this with, honestly with pride because I think people need to hear it. It took me 13 months of dedicated time to do step one. I did it when it was a 3-digit score. So I knew I needed a score, there was no option for me to get below that. Some mentors in the States told me, yeah, if you don't get a score above that, it's just not even an option, So I made sure I took the time to do that where other people would say, oh yeah, should I get it out of the way quickly? But no, I made sure I took my time to do it. But then I had a lot of people in my corner who were supportive. My family has been absolutely supportive, especially with finance as well. Many times I wanted to say, this doesn't make sense. I'm not making any money. I'm slowing down this process. If I stay, there's so many other options. And they were like, nope, we're not letting you give up. Don't worry about it. They were fully supportive. I just got married as well. So she's now my wife.
Congratulations.
Yeah, we got married 2 months after I matched because I was waiting to be matched. Yeah, that's another story, but that was another thing I was holding up because I wanted to match first before we got married. But they were super supportive as well. They moved up with me as well. So everyone in my corner was super supportive. So I had people to talk to because sometimes you kind of feel like you're on an island in the process, especially when all my friends have already matched. So there's no one really to talk to about it. But yeah, so having the support is very necessary.
And my final question to you tonight, Joshua, is what do you want your legacy to be in the field of ENT?
That's a good question because I'm still trying to think every day. Like that's something that I'm very cautious of as well. I definitely want it to be perseverance, hard work. Also, I want philanthropy, empathy. I want people to show what it is to really give forward. Because my whole life story was, really those resources I had, the family, the network that I had. And I really want I want to pay it forward as well in the future. I'm still trying to decide what I want to do with my career path, but I definitely know that it's going to be something that is helping in general the people who need the help the most. I know that even it may look in different ways, even if it's not only my patients itself, but just the students and the people I interact with in my life. I'm very involved with mentorship as well, helping people on this pathway. And I just want that at the end of the day, I know that I did as much with my story to help other people's story with their own lives. I don't want my story to stop with me. It kind of sounds a bit sad that, if you think about it, I can do all this hard work, spend so much time on my own life, but at the end of the day, it's going to end. I'd want that it continues forward. I'd want that at the end of the day, other people matching the ENT or competitive specialties or Jamaica just having more children like me who had these developmental disorders, had these difficulties going through the regular school system, and they found a way to get through it. So I kind of just want to open the doors and make sure that they stay open after I leave.
I'm trying to think if I've ever spoken so little during a podcast interview. I'll go back and count the words and see if I said 100 words in this episode. Hilarious. Thank you so much. It was an absolute pleasure hearing your story, hearing about your dedication to the field and your aspiration for the impact that you want to have. It's not lost on me that you said a couple times that the IMGs who you've met in ENT, that you guys have very similar CVs. But definitely, with the work that I do, I always say to people that the CV might be the same, but the story is never going to be the same. And your personal journey will always differentiate you from other people. And you have such a powerful personal journey. I have all this imagery of your mom putting you in the car 3 times a week, to carry somewhere. Like, if that is not love, I don't know what that is, And I feel like what you're doing, it's wonderful that you pay it forward to other people, but I think it's also a tremendous way to honor all the people who were there for you, and I'm sure that it will continue beyond you. So thank you so much for taking the time to share your story with all of us. And I know that all the IMGs who want to match into ENT and everything competitive took their notes, and they'll be following the blueprint that you've given us. Thank you so much, Joshua.
You're absolutely welcome anytime.
Hey friend, thank you for listening to the IMG Residency Match podcast. If you're ready to create a memorable application that gives you the best possible odds of matching into residency, connect with me at bit.ly/IMG match. That's all lowercase. And you can find me on Instagram, YouTube, and Facebook at Memorable Essay, or handle is Memorable Essay. If you enjoyed this episode, be sure to follow, leave a review, and share it with another IMG who's on their match journey. Your support helps more ambitious IMGs to find our show. Until next time, keep focused and be memorable.